Greetings and welcome to In Depth. I'm Dike and Rostant. World Kidney Day is observed annually on the second Thursday in March. And to speak to the need to take care of these organs, we are happy to be joined by Dr. Anisha Sookoo, Consultant Nephrologist, and kidney recipient, Mr. Stanley Reid. Dr. Sookoo, Mr. Reid, we want to thank you so much for actually making the time. But I want to start off with you, please, Mr. Reid, in terms of giving us your story, your experience of realizing that you had a need towards getting a kidney. Thank you.
Okay, well, I've been working in the point leases industry for a number of years. While I was working there, I found that the activities were very hectic. And in 2008, I was diagnosed as having chronic kidney disease. And that was essentially due to high blood pressure. Following that, I had some discussions with my doctor who referred me to the National Organ Transplant Unit at Mount Hope. I met Dr. Roberts and a team. While I was there, I underwent a number of tests, and they determined that I would need a donor. I went home and spoke to my family, and after discussions with them, my youngest son, Stanley Reid, told me that he is willing to donate one of his kidneys to me. At first I told him, no, I don't want you to do that. But he was insisting that he had to do it. So after some discussions, we agreed. And in 2009, September the 29th, I was able to undergo kidney transplant at the unit. And that was the beginning of a change in my life. Because before that, I had to undergo dialysis 3 times for the week for about 1 year. After having undergone the transplant, life was totally different. And after I got the transplant, it was one of the best experiences that I've ever had. As a matter of fact, after that, I wrote to all of the daily newspapers commending the staff of the National Organ Transplant Unit because the experience there was par excellence.
And I want to get to that experience in a little bit, but even before we bring you in, please, Dr. Sookoo, Mr. Reid, how did you find out? Is it just that you were running a random test, or how did you find out that, okay, well, I need a kidney?
Right. So I had high blood pressure. When I went to the doctor, Dr. Patrick, late Dr. Patrick, he did some tests and he recognized that my kidneys had failed. And following that, he then referred me to the organ transplant. And it was largely because of high blood pressure. And again, most likely because of the kind of hectic life I was living. And also, I wasn't really taking the necessary care of myself as I should have been taken.
Okay.
Yes.
And how does that mesh with other experiences, other patients that you've had to interact with, Dr. Sookoo?
That happens very commonly, actually. Most patients will be diagnosed with non-communicable diseases like diabetes and hypertension. And I think education is lacking, so they don't understand how important it is to take your medication, continue your follow-up with your doctors. As often as we ask you to come in, we're asking to do that because we know what happens if you don't. The end organ damage that can happen, and it's not just to your kidneys, it's to your eyes, your brain, your heart. Of course, I'm biased to kidneys because I'm a kidney doctor, but yes, if you don't take your medication, it will play a significant role in the progression of your disease, and your disease will progress much faster.
Okay, and even like looking at that progression, are there symptoms that accompany this?
So with the kidneys are an organ where it's a silent killer, somewhat like hypertension. You don't know you have kidney disease unless you get a blood test or a urine test. Your kidneys will tick along until you're at end stage or very close to end stage, and then you will get the symptoms. And the symptoms that you get, you may not even take them on as thinking you're sick, because you get a little bit of fatigue, you feel very weak, you feel like you can't do tasks that you were doing before. You may get some swelling of your legs, but you may not think, is this my kidneys? So oftentimes patients are diagnosed a bit later on.
Okay, is there a demographic that you would go, be it male, female, age grouping, looking at profession? Because see, Mr. Reid, because I remember I was on the industrial estate for a little bit too, and sometimes if somebody calling sick or they just calling, so you need to do that double, and you didn't plan so that it's easier to get something to eat from right around the place, so and then even like things like lack of sleep.
So diet plays an important role. We recommend for everyone, not just patients who have diabetes or high blood pressure or kidney disease, a low-salt diet. That's just a healthy lifestyle. We also want to limit processed and preserved foods, a lot of refined sugars, and that's for everyone. In terms of an age group, yes, people over 60 are more prone to having diseases that like diabetes, hypertension, and of course kidney disease. Obesity is a risk factor for kidney disease, diabetes, high blood pressure, a previous history of having any strokes, any heart attacks or heart disease. And if you have a family history of any kidney disease, we always ask that if you have a member of family who has had kidney disease, please follow up with your doctors and get checked. Yeah. Also, some patients, when they get ill, so if you get, let's say, COVID-19, I'll use that as an example. If you get COVID-19, sometimes your kidneys get sick as well, and you get something called acute kidney injury. If you have had a history of having acute kidney injury that has resolved and your kidney function has gone back to normal, you are more predisposed to having acute kidney injury and following episodes of illness, and that can lead to overall chronic kidney disease.
And it seems as though or even outside of that, you said check with your doctor. So is someone doesn't need to go to a kidney doctor specifically, you can go to your general practitioner.
Yeah, so ideally when you are first going to see someone about diagnosis, it's a simple blood test that they do to look at something called the creatinine, which is a marker in your blood test to tell you how healthy your kidneys are. A doctor can do that. A doctor can also request a urine test. Depending on what level your creatinine is and what stage of kidney disease you're at, then you are referred to a nephrologist. So there are 5 stages of kidney disease. Stage 1 being the best, stage 5 being end stage, where everyone starts to talk about dialysis and transplantation. Usually nephrologists come in around stage 3 to 5, but before that you can be seen and managed by your general practitioner, your doctors in your local health center, or a doctor from another specialty who is seeing you.
All right, and with that we take a short break. We are speaking with Dr. Anisha Sookoo, Consultant Nephrologist, as well as Mr. Stanley Reid. And you see that date you spoke about, the 29th of September 2009? I want to come back and we talk about that, thank you. But stay with us, we come back with more. Welcome back. We are speaking with Mr. Stanley Reid as well as Dr. Anisha Sookoo, and we're looking at kidneys, the importance of them, and just we're getting the experience and insight from the consultant nephrologist, as well as that lived experience. And we want to go back into that lived experience a little bit, Mr. Reid. The way that you're just able to call that date is almost as though the date you got a new lease on life. How important is that date? It's almost as though it feels as though there's a before September 29, 2009, and an after. So talk about that date to me first.
Okay, that date is really important because, to be honest, it meant a change in way of living, right? I was going to dialysis 3 times for the week. After that, life became back to normal. And back to normal, I meant that I could have done what I was doing. The only difference really was with the diet that I was undergoing. And the diet essentially was low salt. As a matter of fact, I put away salt. And I was using herbs because they said, once you use herbs, that more or less negates the necessity for using salt. My diet was changed. apart from the diet, life went on as per normal.
Okay, and speak to dialysis a little bit, please, because from what I hear, it's almost as though you go dialysis one day, but it feels as though you could lose kind of 2 days because you're trying to kind of get back.
Yes.
So how was that experience for you?
Well, fortunately for me, I used to go down there around 6 o'clock in the morning and spend about a couple hours, 3 hours. And then from there, I was fortunate that I was able to drive back and go to work. I know a number of people who had a totally different experience because after dialysis, a number of my friends and people who I became familiar with, they were not able to return to work for that day and sometimes for the following day. So the effect that it has on people, varies. Thank God it wasn't as serious with me as with others.
Well, you're saying that and I getting surprised, and I'm grateful as well. But talk to me, because apparently there's more than one type of dialysis,
There
Dr.
is,
Sookoo.
yes.
Dr. Sookoo?
So what we do is when you talk to your kidney doctor, we will talk to you about, and when you're diagnosed with stage 5 or end stage, we talk to you about renal replacement therapy options. And that's just a fancy way of us talking about dialysis and transplantation. So in dialysis, there's hemodialysis, which is the one that Mr. Reid was on, and it's the most common type that most people know about. It's where you go into a center 3 times a week, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Your blood is taken out via a line or a fistula in the arm, passed through a machine or your artificial kidney and put back in. The other type of dialysis is called peritoneal dialysis, and that's where you do the tummy. So it's instead of a nurse led in a center, it's a dialysis form where you do it at home. You get bags of fluid, you put fluid in the tummy, and you drain that fluid out, and that is your dialysis. Your abdominal cavity has a membrane, and that membrane acts as your filter.
Okay.
So there are 2 types.
Okay, and are there things that would say, okay, well, this one will work a little more?
Yes, so dialysis, both peritoneal dialysis and hemodialysis have the exact same efficacy. They're both proven forms of dialysis and renal replacement. The type of dialysis is individualized to the patient. So some patients, because peritoneal dialysis is more led at home by yourself, so you have to be able to see, you have to be able to connect yourself to your machine, you have to be able to do things on your own, be independent to a certain extent. There's a little test that we call it. So when you are referred for different options of dialysis, we do send you to see the peritoneal dialysis team of nurses, and they sort of go through things with you to see whether you are a patient who can, in fact, do peritoneal dialysis. The other contraindication to peritoneal dialysis is if you have a very big abdominal cut. So if you had a surgery in the tummy before with a very big scar, the chances of you doing successful peritoneal dialysis is very slim to none because the catheter floats in the tummy and it can stick in your scar tissue, unfortunately. So that is a kind of patient we would say go ahead and do hemodialysis.
Okay.
But it's very dependent on what the patient wants.
Okay, because I can imagine someone saying, okay, well, I'm very happy to do this at home.
Yeah.
Possibly in
Yes,
time
it gives you freedom. It gives you a little bit of independence, a little bit of freedom. Most peritoneal dialysis patients do their dialysis overnight when they're asleep. Yeah.
Sleep lying on the back though? Okay.
Mm-hmm.
All right. But Mr. Reid, I wanted to give me a little information about the kidney recipient support group of TNT. What was conversation with like, was it a support group in terms of saying, okay, well, these are some of the things that work for us. What was the experience with them thus far?
Yeah, okay. That group definitely has been a great support to all because once you completed with the transplant, you need some support. And that group was an ideal one. So that group, the kidney recipient support group, would normally meet on a regular basis. And you're also able to have direct contact and discussions with others who would have gone through the similar experience with yourself. And, with that, we were able to do a couple of things. One, share experiences, things that work, things that, tend to be a bit problematic. And so that was one thing that was very helpful, that support. Second thing with that group is that we were able to go out there in the community also, to the malls, to various schools, and share our experiences. And so that people who may not have been quite familiar with the type of challenges that people could go through and the opportunities that are there for individuals who need transplant, we were able to share those experiences. And it definitely was a very useful. We felt energized being able to give back and share our experiences, with those who needed it.
Okay, we have about 3 minutes more, so that's 1.5 if we do the maths properly. I want to ask you though, your youngest son, he said, "Me, daddy." And you say, eh.
That's correct.
What's going through your mind at that point in time?
Yeah, okay. I mean, he's now growing up. I didn't want to, if I could use the word, deprive him of, going through that kind of experience. But, I mean, because of his passion and his care and his love, he said yes. Then I said, no, Sheldon, because I want you to have, the best. But thank God he was insistent, and I'm very grateful. Very, very grateful.
Thank you so much for that. And put a bow on the conversation, please, in terms of like what should people be looking out for, Dr. Sookoo, if there are any words of advice, and even just things that we should be thinking about, one during this week, one on the dates of World Kidney Day, and even outside of the day, because it's one day, but we have our entire lives to live.
Yes. I would say just make sure that you take good care of yourself, take better care of yourself. Exercise, follow a diet. It's hard to do, yes, hard to start, hard to maintain, but it's what's best for you at the end of the day. You need to, if you have diabetes, if you have high blood pressure, make sure you're seeing your doctor, getting your bloods and urine tested every 6 monthly. If you are completely well, annually or every year is perfect for you to get testing. If you're getting older, just go to your doctor a bit more often. So over 60, I would say go to your doctor as well biannually. So twice a year, every 6 months. Those are the important things. Our goal, if you are diagnosed with kidney disease, is to slow or stop the progression of kidney disease. So we don't want you to go from stage 3 to 5. We would prefer if you were diagnosed at stage 3, well, we can't reverse what's already been done. We could maintain you at stage 3 with medication, proper follow-up and visits. So that's what I would say for everyone. Diet, exercise, listen to your doctor's advice. And if you think that, your doctor may not be telling you the right things, ask questions.
And we want to thank you both so much, Mr. Stanley Reid, Dr. Anisha Sookoo, and we want to thank you as well. And also want to thank the Kidney Support Group of Trinidad and Tobago. It's an NGO that raises awareness on kidney health and transplantation in Trinidad and Tobago. And hopefully we would have put, the hashtag or the handle rather, KRSGOTT, so you can check them out on Instagram and Facebook. On behalf of the entire news team, I'm Dike Rostant. Thank you so much for joining us.